at FOHBOH, a Nashville business that matches hospitality workers with industry jobs. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. It's been just over 5 weeks since we asked all Nashvillians to practice safe social distancing protocols to help prevent the spread of COVID-19 and save lives in our community. And your continued efforts to remain safe and adapt to the coronavirus era have been incredibly inspiring. From front porch birthday parties to meals shared over FaceTime with loved ones, I am inspired by your resilience, abundance of support, and love for one another, and the sacrifices that have been made to protect public health as we look forward to safely restarting our economy. Now, please continue to remain at home whenever possible and only leave your home to run essential errands. And remember to wear face coverings whenever you're out in public and not able to safely social distance, as both the CDC and the Metro Public Health Department are recommending. Make sure your face covering material covers both your nose and mouth and that you can breathe through the material if the face covering is homemade, and wash it after use. We are continuing to closely examine the public health benchmarks required to safely enter the first phase of the roadmap for reopening Nashville. In addition to these benchmarks, epidemiologists at the Metro Public Health Department are working hard to gather critical race and ethnicity data that helps us better understand how COVID-19 is affecting different members of our community. Dr. Alex JAHANGIR will provide more details on both our roadmap criteria and our updated race and ethnicity data momentarily. Now this morning, I want to welcome back Jim Brown, Tennessee State Director of the National Federation of Independent Business, who is here this morning to discuss the reopening of the Paycheck Protection Program, an important lifeline for business owners in Davidson County that has received a new round of federal funding. I also want to welcome Holly Hayes, co-founder and CEO of FOHBOH, a local Nashville company doing fantastic work to match hospitality workers with jobs at area restaurants and hotels. A welcome service as we approach the phased reopening of these industries that are so critical to Nashville's economy. And as always, it's wonderful to have Dr. James HILDRETH, President and CEO of NEHARRY Medical College, here with us to provide his insights into the coronavirus and our response, both as individuals and as a community. And this morning, I also want to announce a series of informative webinars hosted by Dr. Alex JAHANGIR and other public health officials, presented by our office and the Metro Nashville COVID-19 Task Force. These webinars are designed to help local business owners and their employees adopt to this new era of social distancing. A webinar for restaurant owners and operators will be held this Thursday, April 30th, from 1 p.m. to 2:30 p.m., featuring Martha Boyd of Baker Donaldson, Benjamin Goldberg of Strategic Hospitality, and Derek Moore of Slim & Huskies. A webinar for owners and operators of other types of small businesses will be held on April the 30th from 3 p.m. to 4:30 p.m. and will also feature Manuel Delgado of Delgado Guitars and Mark Faulkner of Vireo Systems. To learn more about these webinars, visit Metro's COVID-19 website at covid19.gov.nashville.gov. Now, I'm tremendously grateful to these local business leaders for participating in these webinars to help other Nashville employers better prepare to keep their employees and customers safe as we look forward to the phased reopening of Nashville's economy. As a reminder, you can visit covid19.nashville.com to review the roadmap for reopening Nashville and submit your valuable feedback. We continue working with health officials and members of the community as we help Nashvilleians safely get back to work and business as usual. And in the meantime, let's work together to reduce the rate of coronavirus infections in Nashville and support our frontline healthcare workers. As always, I urge you to visit the Metro's COVID-19 website and consider donating to the COVID-19 Response Fund by visiting the covid19.nashville.gov website. Here you can also learn how to obtain direct financial, food, mental health, and social service assistance. And I'll turn it now over to Dr. Alex JAHANGIR, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning. Here's the latest on coronavirus in Davidson County. We have 2,612 confirmed cases. That's an increase of 24 cases in the last 24 hours. The total number of fatalities is also 24. There are an additional 2,167 cases in the surrounding counties, bringing the total in our region to nearly 4,800. Of the Davidson County cases, 1,260 are currently active, and 1,328 residents have recovered and have been cleared. The Safer at Home order in Nashville is set to expire this Friday, May 1st. From the beginning, we have said we will let the data drive our decisions. We cannot look at one good day of data, nor one bad day of data. We have to look at the whole picture. That's why we're looking at multiple metrics. We have been reviewing the data, consulting with healthcare experts and business leaders, and reviewing comments from the public. We will be meeting with the mayor later today to work on the next steps for our city and what our city will do to battle this virus. I also want to update you on a developing situation. Late last night, we were made aware of a possible isolated outbreak of the virus at our homeless shelters on the fairgrounds. 4 individuals who entered the shelter without symptoms later tested positive. These people were screened when they first arrived at the fairgrounds and did not have any symptoms of the virus. When the individuals started showing symptoms, they were tested and moved to the self-isolation portion of the shelter for people awaiting test results. Once the test results came back positive, the Metro Public Health Department began investigating. We believe these people did not get the virus at the shelter. Today, the Public Health Department will begin testing the residents and staff of the fairgrounds. That will be around 220 individuals. We'll continue to contact Trace to investigate and contain this outbreak, and we'll keep you updated as we get more information. Today, I want to share the latest race data we have collected. Of the Davidson County confirmed cases, 36% are white, 13% are Black or African American, 12% are multiracial or other, 6% are Asian, 6% unknown, and 27% are pending. And of the 24 Nashvillians who have died, 11 are white, 9 are Black or African American, 3 are listed as other, and 1 is Asian. Now, it is important for us to analyze and understand this information. This virus impacts those who are most medically vulnerable to the condition. As you can see, while Black Nashvillians make up 13% of the confirmed cases in Nashville, they comprise nearly 40% of the deaths in our community. This virus, like other medical conditions, is highlighting the impact of health disparities in our society. Minorities and those with limited access to health care are most seriously impacted disproportionately. That's one reason we placed the community assessment centers in communities where people may not have the easiest access to health care. These centers are there to fill the gap in the assessment and testing available to all of our residents. Now, based on 4,145 tests conducted at community assessment centers, 22% of patients were Black or African American, 8 were Hispanic, 6 were multiracial or other, 2% were Asian, and 12% were white. And another 50% of people declined to answer the question. Of those who did disclose their race, 2/3 of those individuals tested were people of color. Now, from the start, we designed the community assessment system to be available to all Nashvillians, and these numbers show our outreach is working. Now, today, the 3 sites are open until 3 p.m. at Nissan Stadium, NEHARRY Medical College, and the old Kmart on Murfreesboro Pike in Antioch. Also, the assessment hotline is open today from 7 a.m. to 7 p.m., as it is every day. If you think you have COVID-19, if you've been around others who were tested positive, or if you're worried about the virus, please call our hotline or go to our community assessment center. There is no charge for the assessment from the medical personnel, nor the test. Now, finally, we are taking precautions through the Safer at Home order. We have resources to help you through the community assessment system, and we have excellent healthcare facilities in the city if, unfortunately, you do get the virus. However, with all of this in place, it still comes down to you. You have to be responsible to do your part to fight the virus. Please continue to stay at home unless you absolutely need to go out. When you do go out, wear a face covering, practice social distancing, and return home right away. Keep it up, Nashville. Together we will get through this. I now would like to introduce Dr. James Hildreth, President and CEO of NEHARRY Medical College.
Good morning, Nashville. Over the last couple of weeks, there's been a lot of discussion about antibodies and antibody tests. So this morning, I want to give you a few things to think about in terms of antibodies. I shared with you earlier that when we get infected by a virus, our body makes two major types of responses. There are antibody responses to eliminate virus particles, and there are T-cell responses to eliminate the infected cells. Antibodies are one of the major ways that we clear infectious agents from our bodies. So, the very first time that we see a virus, we make what's called a primary response. And in the case of COVID-19, since no one has ever been infected by the virus before, all of us are making primary responses to the virus. After a lag period of about 10 days to give B cells a chance to be programmed, they start to make antibodies to the virus. The first kind of antibody that's made is a very interesting protein called mu immunoglobulin. We call it IgM. These antibodies are very, very large. They can wrap things up like wrapping them in a blanket and facilitate their disposal. The second type of antibody that's made is gamma immunoglobulin. We call it IgG. These antibodies are much smaller. They bind more tightly to the virus, and their job is to attract the attention of other kinds of responses that will help to eliminate the virus. The point is that IgM antibodies give us an indication that you're early on in your infection, and IgG antibodies occur later, and they can actually persist for up to a month or so, even after the virus has been cleared. So the value of antibodies and antibody testing is they can tell us that someone has been exposed to the virus or infected by the virus, and depending on what type of antibody we detect, we know that that person is early on in their infection or they're later in their infection. The problem with some of the antibody tests that you've heard about is they suffer from a low specificity or low sensitivity. Sensitivity is how we measure whether or not an antibody picks up all the infected people who are out there. The other measure is whether or not we're missing negatives. In other words, we need to know that the antibodies we're using are not missing those who are positive and not reporting those who are negative as being positive. Those are specificity and sensitivity measures of antibodies. And in fact, they're not very good for some of the antibody tests that are out there. To give you an example of how powerful these tests can be, you may have heard that in New York City, they tested thousands of individuals with an antibody test. An extrapolation of the data showed that as many as 25% of the total population of New York might have been infected by COVID-19. So what that would mean is if that is true, the fatality rate of this virus is actually much lower than we thought because so many people have obviously survived to test positive with the antibody test. So that would be good news. But unfortunately, we don't quite know yet whether that antibody test meets the criteria of sensitivity and specificity. Antibody tests would also be very useful in contact tracing that you've heard about, in which you identify positives, you identify all the persons who have been in contact with them, and you ask those people to be quarantined. If we were to take the contacts and test them for virus with a PCR test and antibodies with an antibody test, those who test negative for the virus but positive for antibodies have obviously been exposed, infected, and cleared the virus. They would not have to be quarantined. So that would be a very helpful way to make sure that we're not missing people who otherwise could be free of quarantine, having them be in quarantine. That's just one of the ways that the antibody test could be very useful. So COVID-19 belongs to a family of 7 viruses called human coronaviruses. They have some genomic similarities, which means that some of their proteins look very similar. And antibodies recognize shapes of proteins or how these proteins look. What that means is that an antibody to COVID-19 could very well cross-react with antibodies with viruses that are in that family. Likewise, antibodies to the other members of the family could bind to COVID-19. That's why we have to make sure the antibody tests we're using recognize COVID-19 and only COVID-19, not other members of the family. And that's a major problem with some of the antibody tests. So antibody tests are very useful. They've been used in Los Angeles, New York, other places. But we need to make sure the antibody test that we're using meets those criteria of sensitivity and specificity. And we're in the process of evaluating that to make sure the antibody test that we use will satisfy and meet those criteria. So Nashville, as you heard Dr. Jahangir say, we have done a great job over the last several weeks of flattening the curve, but we've not flattened the virus, okay? The virus is still out there. It's gonna be with us. And what we need to do as a community is take personal responsibility to protect ourselves. And if we do that, we protect our community. Businesses will open, and I'm not asking you not to patronize businesses. Do not get me wrong. I am asking you to make an assessment of whether or not you think that facility has taken the appropriate steps to protect you and to protect their employees, because that is a chance for transmission to occur. So let's use what we know. We know that if we stay home, wear face coverings, protect our T-zone, wash our hands frequently, sanitize high-touch surfaces, we can keep the virus in retreat. So Nashville, we got this. Please don't be a vector. Thank you. Now I'd like to introduce Mr. Jim Brown from the National Federation of Independent Businesses.
Well, thank you, Dr. Hildreth, for your leadership, and good morning, everyone. Thank you, Mayor Cooper, for inviting me back to speak. When I last spoke 12 days ago, things were very fluid for small business, and they remain fluid. Last week, Congress voted to add another $310 billion to replenish the Paycheck Protection Program. And after some serious glitches on Monday, we heard yesterday that those PPPO monies began to flow to small businesses, which is very good news for a lot of those businesses that many of them were waiting nearly a month. On the Economic Injury Disaster Loans, or EIDLs, Congress authorized another $60 billion in funding, $50 billion for the loans and $10 billion for the emergency grants. But it is our understanding that the SBA is not accepting new EIDL applications. We are hearing the new funding is being used to satisfy the overwhelming demand that's already in the pipeline. NFIB is fully expecting that both rounds of assistance will go to small businesses who need it most, and not to publicly traded companies and large businesses that have access to other credit options. But that's a big deal that we've been communicating with Congress, and that needs to happen. Going forward, our team is moving, is calling for and asking for more flexibility for small businesses in the Paycheck Protection Program. And that includes the removal of the SBA requirement that 75% of PPPO loans be used for payroll costs in order to be forgiven. And it's just a threshold that's too high for far too many small businesses that have payments like rents, utilities, et cetera. One last thing on the SBA loans, it is critical for loan recipients to keep meticulous records. The SBA's put out some guidance. They've actually updated their FAQs 10 times since April the 3rd, and more guidance is expected. You just want to be sure that your records are in order, and definitely keep talking to your tax professional. It is nearly 4 weeks since NFIB's research told us that about half of small businesses said they can survive no longer than 1 to 2 months in current conditions. On Monday, NFIB Tennessee released our 10-point state plan to protect and support Tennessee small businesses and help them survive. And you could find that plan at nfib.com/TN. In the plan, we included a recommendation to establish a state emergency bridge loan program. And we're asking members of the Tennessee General Assembly, our state lawmakers, your state lawmakers who are scheduled to come back June 1, to set up this program this summer for businesses that miss out on PPPLs or EIDLs. And those are state lawmakers. Those are not your Metro Council folks, but your state senator or your state representative. We plan to mobilize NFIB's 6,000 strong membership in Tennessee in the weeks ahead, so stay tuned. I'll end with some other helpful websites, nfib.com/coronavirus, where you'll find information on the SBA loans and much more. And the mayor already mentioned sbtfnashville.com, sbtfnashville.com. That's our city's excellent website for small businesses. My email address is jim.brown@nfib.org. Mayor Cooper, thank you again for all your work and all the good work you and your team are doing. And cheers, y'all. Cheers, Nashville. We're going to keep at this, and just let us know how we can help.
Thank you, Mr. Brown. I'd now like to turn it over to Hallie Hayes, co-founder and CEO at FOHBOH.
Thank you, Chris, and good morning, Nashville. I'm Hallie Hayes, co-founder and CEO of FOHBOH. We are a new and innovative platform that matches talented candidates with restaurant jobs in Nashville. With restaurants preparing to reopen, we are in a position to help the industry get back on its feet as quickly as possible. There's so much talent in Nashville, and our technology pairs those individuals, the servers, the bartenders, the cooks, with available jobs instantly. We take into account the wants and the needs on both sides for a better fit all around and make the process both easier and faster. Our goal is to support the Nashville hospitality industry as businesses begin to reopen. In light of that, we are waiving our monthly fee for 90 days to all Nashville restaurants once they make the decision to reopen to the public. Our website is fohandboh.com. That's FOHANDBOH.com. We want to get the message out to individuals who are laid off and are looking to get back to work, as well as to restaurants who are in need of employees as they reopen. We are fortunate to have partnerships with top restaurants in Nashville, such as Merchants, Liberty Common, Etch, Edley's, etc., and Skull's Rainbow Room, just to name a few. We hope to widen our partnerships to help the thousands that we have in our database already. We want to encourage every hospitality worker who hasn't already done so to create a profile today in preparation for the reopening. Due to increased demand and requests from the market, we plan to extend our services to the hotel industry over the next month. As well, we encourage hotels and hotel workers to create a profile and sign up today. Thank you very much.
Thank you, Ms. Hayes. We will now start the Q&A segment of today's briefing. As I announce your name, you may proceed by asking your question over the air. We'll start with Jeremy Finley at WSMV.
Good morning, everybody. My question has to do with the enforcement of the non-essential businesses. I wanted to see if you all continue to have to, if you've had to shut down any new businesses or issue any fines as the businesses over the county line are starting to open. I just wondered if businesses here in Davidson County are, getting to the point to where they feel like they have to risk it just to remain competitive. So I wanted to see if you all have had any more issues with having to shut down any new businesses or issue fines.
Thank you, Jeremy. Dr. Caldwell.
Good morning. At this time, no. The teams of inspectors of the Department of Public Health and the police continue to go out and respond on complaints that anybody might put forth on your smartphone at Hub Nashville or the COVID-19 website. So far, since April 1st, the Department of Public Health and these teams with the police department have visited 420 locations. We have found them to be overwhelmingly, the majority of them to be in compliance, and our inspectors still have not cited anyone for non-compliance. So our teams will continue to respond to these complaints. We'll also conduct unannounced follow-up visits to any bars or non-essential businesses that seem not to be following the order. These teams of inspectors and police officers are working alternate shifts, so that allows us to conduct visits not only during regular business hours, but also late into the night. So enforcing the Safer at Home order continues to be essential to reducing the spread of the virus. I'd like to thank Metro Parks as well as Metro Police for their continued support to helping us remind everyone to make sure that we're socially distancing. Remember, you can submit a complaint at the Hub Nashville or COVID-19 website. Thank you.
Julia Palazzo at WKRN.
Thank you, Chris. Good morning. Two questions. Mayor Cooper, I've been hearing from some people in Southeast Nashville, of course, where they're dealing with a high number of cases. Some essential workers there have concerns because a lot of them don't have access to personal protective equipment like in grocery stores. Just wanted to know how you're working on getting that equipment for the areas hit hardest. And then Dr. Jahangir, just based on the situation at the fairgrounds, what you know so far, I know you guys are investigating. Are you really concerned after when you test everyone? Do you think there's a huge chance that there's going to be a large number of positive cases? Thank you so much.
So the first question is about PPE for essential workers in the Southeast and what the city may be doing in terms of outreach there. And then your follow-up question was about the fairgrounds. Dr. Jahangir.
Hey, Julia. Thank you for the question. Really quickly, regarding the PPE question, in short, the needs of PPE for our community is obtained from the state and TEMA and Unified Command. And so we will try to help businesses that need it, but understand at the end of the day, the Unified Command and the state are really helping get that for us. So we'll do our best to help, and they can reach out to that. Regarding the fairgrounds, what I'm proud of, I mean, listen, we quickly identified that somebody became symptomatic. We quickly tested that individual, and then quickly tested the individuals within that person's immediate circle. Our public health team really, I hate the word used, attacked, but essentially attacked the situation, recognized who were close contacts, tested the people, and placed the people of concern in the part of the shelter that is for people under investigation. What we're doing is testing the entire shelter is really being over precautionary, and I think it is important to be very careful around there. But I think the public health system did exactly what the public health system needs to do, and we quickly identified, we quickly isolated, and we're quickly testing. So thank you.
Tosin Fakile at WSMV.
Good morning. Thank you, Chris. I had 3 questions, 2 for Dr. Jahangir and the other one for Mr. Jim Brown. The 2 questions are, the first is, with the outbreak at the fairgrounds, would you guys have to clean or move them from the shelter or from one place to the other at the fairgrounds? And the other question for Dr. Jahangir is, were the shelters at the fairgrounds set up using CDC guidelines versus FEMA shelter guidelines? Just something I was wondering. And the final question for Mr. Brown is, I know he said some of that payment protection check has started to come out. I was wondering how quickly the businesses are getting it, or if they've gotten it already. If he said it, I must have missed it when he did. Thank you.
We'll start with Dr. Jahangir.
Hey, thank you for your questions. So the fairgrounds are set up with CDC as well as our public health team. Mr. Hugh Atkins, our Caldwell, I know we're very integral in the setup. The way it's set up is there are areas that are cordoned off. So each pod, I think, has about 25 individuals in it. And so we try to minimize cross-contamination of even the well individuals from one pod to the next to the next. So that's one way we try to minimize contamination if there is a positive case, because obviously we always thought about this scenario happening. Regarding whether we have to go in there and clean everything out, when somebody tests positive or somebody is a person under investigation, we move them to a separate part on the fairground site, so a different building, and that's where people are. Let's see what the investigation shows, let's see what the testing shows to see if anything further needs to happen is regarding cleaning the facilities any further. But as of right now, everything that guidelines tell us to do, we've done, and we've set up these multiple buildings for exactly this scenario. And so right now, I think we're in reasonable place. So I'll update you as soon as I know more. Thank you.
We'll turn it over to Mr. Brown for the follow-up question.
Yeah, thanks, Chris. Thanks, Tosin. In talking to my good friends at the Tennessee Bankers Association, in the $310 billion in the PPL funding, that it got off to a slow start Monday. There were glitches, but the money started flowing yesterday. The bankers tell us they think that money will be in the hands through the door, into the accounts of small business owners within 72 hours. That's what we're hearing. So there's obviously going to be some more demand there, and you're watching the national news like we are. There's going to be conversations about potentially more funding. I've already seen Speakers McConnell and Schumer and Speaker Pelosi, but Majority Leaders, excuse me, on McConnell and Schumer and Speaker Pelosi already starting to talk about this. So we'll see. We've heard the demand could be as high as $1 trillion total for for all the folks that are asking for support through the PPL program. So that's what we know, and we'll keep our eye on it like you are.
Harriet Wallace, Fox 17.
Yes, good morning, everybody. I have a couple of questions. One, Dr. Jahangir, I know you mentioned, I believe it was last week, about more of a, I don't want to say task force, but a more centralized, concentrated effort on the death disparities within the different races. I wanted to, specifically with regard to African Americans, wanted to check in on the status of that effort besides the test centers being set up, for example, at NEHARRY. What other efforts are in place to mitigate the death, not just for African Americans, but for everyone? My second question is in regards to the fairgrounds. Anytime that there is an outbreak, or even just for best health practices, there is cleaning that is required. But you just mentioned we'll have to see what happens with the testing to determine what we do with cleaning. What is the plan to, A, ensure the cleanliness and safety of that area now? And is there a secondary site that is on standby should there be further issues at the fairgrounds? Thank you.
Thank you, Harriet. Dr. Jahangir.
Harry, thank you so much for your question. Regarding your part around disparities in deaths, I don't know if I said this, I apologize. There's not a specific task force or so forth to look at the exact disparity number of why maybe 9 African Americans have died out of 22 or 24, excuse me. It is something that we are always constantly looking into, speaking to. I spoke with Dr. Hildreth before this press conference. So there's not a specific task force. There's a task force to look specifically at our increased outbreak in the Southeast corridor, which happened to be people of color and immigrants. So maybe there is that task force. So I apologize if the two were separate. Now regarding the fairgrounds question, every day the fairgrounds are sanitized per protocol. They're cleaned. As I mentioned, there are these pods so that there's minimizing cross-contamination, and the public health system, there's a vigilance of making sure symptoms are recognized, and quickly the public health team comes in and dives into it. And Dr. Hildreth would like to also make a comment, so thank you.
Harriet, the disparity in health and among African Americans has been an issue for us at Meharry Medical College for a long time. So in cooperation with Dr. Caldwell, Dr. Jahangir, Meharry Medical College is trying to reach out specifically to minority communities, because we know that when the virus hits those communities, the level of severe disease and death would be higher. So we are specifically reaching out to faith leaders and to other groups to make sure the word is getting out about how to protect themselves. We are in the process of trying to set up some additional testing and screening for the minority community. So it's definitely something that we're thinking about. We're working together on it, but this has been a focus of ours for 144 years, so we're just doing what we always do. Thank you.
Chris Davis, News Channel 5.
Good morning, everyone. We've gotten emails from a few viewers that have forwarded from several national businesses to their customers announcing potential opening dates in May. Yet, as you know, the city has not announced such a date. What is your message to those businesses? Do you think there's some confusion since Nashville is on a different track than from the state of Tennessee? And would there potentially be any penalties or at least notice to businesses that may be contacting customers about an opening date that has not been determined by the state, by the city just yet?
Thank you. Dr. Jahangir.
Thank you for the question. So I want to reiterate, as of tomorrow, healthcare facilities will start doing more elective procedures. Dental offices will be open. So perhaps some of those emails are regarding those businesses. We are, as I mentioned, looking at the metrics. The mayor in our meeting later today with a group of people to determine when the next steps, what the next steps will be for Nashville. As I believe I mentioned yesterday, we're going to need to give a few days at least for people to know, hey, we're going to open up on this day. So there will be some forewarning, and so it won't be just turn the switch the next day. So I commit to you that we'll make sure to do that. It'll be just enough days to be able to people to bring their staffing up, make sure they get supplies they need, and so forth.
Kara Hartnett at the Nashville Post.
Hi, thanks for taking questions. I am looking for more information on the fairgrounds as well. How many people are isolated or have tested positive there? And do individuals in isolation have to stay there? Also, if there's a large outbreak, if we find a large outbreak after this testing, what sort of backup plans do we have for housing healthy homeless people? Like, are we going to clean? Or will we change facilities? Will there be hotel vouchers? Just any insight you have on that. Thank you.
Thank you, Kara. Dr. Jahangir will field your question.
Kara, thank you so much. So there are 198 individuals in the shelter that are well. There are, as I mentioned, there were 4 people that were confirmed positive, and there were 13 individuals who were close contacts with those individuals. So public health practice says that those individuals need to be tested. So the 4 that were tested, as well as the 13 who are persons under investigation, have been placed in the self-isolation portion of which is a different building on the fairgrounds, and we're waiting for their results. The 198 plus staff and so forth that will be tested today will be tested, and they will be asked to self-isolate until the results are come back. And again, this is a choice. I mean, if an individual chooses not to be tested, we're not going to force a test on them. I want to highlight that. It's really important. Regarding, let's say that it ends up there's a lot of people that are positive, then yes, we have, from day one, actually, we've had a 3rd facility. I think I've mentioned that if you go back in the press conferences, that it's a large facility that's set up, ready for those individuals. And I'm not ready to announce the location, but I just know that cots are set up at this location. All the parameters we've discussed before are set up, and staffing is lined up. But I hate to just jump to that conclusion. My hope is that of these 198 people, that won't be the case. But if it is, yes, we are prepared for that contingency, and involves a 3rd really large place to go to. Thank you.
Brett Kelman at the Tennessean.
Hey guys, 2 quick questions. So just to clarify one more point about the fairgrounds, are these 4 people the first people who have tested positive at the fairgrounds since that shelter opened? And then secondly, can we get an update on the benchmark dashboard? I believe it was going to launch today.
Thank you, Brett. Dr. Jahangir.
There were 2 people who've tested previously at the fairgrounds that were negative. Is what, now, and regarding the dashboard, it will be released soon, Brett. I don't have the exact time, but yes, I understand what you're asking, but it will be released soon. Thank you.
Our final question today is from Nayeli Alamia at 96.7 FM.
Thank you. And I have two questions. One of them is for Dr. JAHANGIR. Regarding the shelter at the fairgrounds, you mentioned that they were tested and it came out negative, and then they were tested later, came out positive. Does this bring any concerns for the businesses that will be opening in the first phase? Will there be any modifications, any improvement for that roadmap? And my second question is for Mr. Jim Brown. Is there anything being done to help those small businesses that are corporations and LLC, but that do not have Social Security or do not have I-10, or that only have I-10? Thank you.
We'll start with Dr. Jahangir and then turn it over to Mr. Brown.
So Brett, I want to clarify my answer to the last question. I got a little bit more information. Two individuals who were tested positive outside, two homeless individuals who tested positive outside of our center previously had been into our ill portion or the area. So, but nobody had ever tested positive who was in the well portion. So let me just clarify that. Now, regarding your question, Nayeli, I don't believe you stated that correctly. These people were never tested. They were screened. So we looked for fevers. We looked at symptomology. We asked them questions, and they screened negative. And then subsequently, they began to show symptoms once they were in the well portion of the shelters. And then at that point, the moment that somebody recognized, hey, this person is showing symptoms, they were tested, and we advanced the protocol. So it wasn't they were tested, the test was negative. So I want to be very clear with that. And that's part of the reason we ask people to get screened. And once you go to businesses, as again, I went to my place of employment this morning, and I'm going after here. And every time I go, I get my temperature taken. And at Office of Emergency Management, where we are right now, we get our temperature taken. So that's why screening is critical. Now, as we move forward, we're looking at ways to expand our community assessment centers, and so that we will have a resource for our community to, if somebody is in a business that an employee comes up and shows symptoms, we'll have a resource in addition to the robust healthcare system we have for people to go to, and I'll have more information to come on that soon. So thank you.
And we'll turn it over to Mr. Jim Brown for the follow-up question.
Sure, that's a great question. There are a lot of people out there that are self-employed, independent contractors, and they are eligible to get the federal unemployment benefit. It's taken the Department of Labor and Workforce Development had to create an entire new system to take those claims and process them. So they're catching up, and people that applied will be able to get that unemployment benefit, and it will be retroactive to the time they apply. But that's taken a little while, but it's there. On the PPPL program, there are a lot of folks there on the self-employed side that had to wait an extra week, and so they were at the back of the line on these applications. So they may not, some of them may not see funding from the PPL money this round, maybe the next round, and it's one of the reasons that we're engaging state lawmakers on an emergency bridge loan program that North Carolina's got something we're taking a look at, and maybe the state can set something up for some of those really small folks, smaller loans, bridge loans that you don't have to pay for several months, but you will have to pay them back at a lower interest rate. So we're trying to do everything we can to help.
We've addressed all the media questions in the WebEx queue this morning. I'd like to thank Dr. Hildreth.
All right, everybody, you're watching the daily Metro briefing from the Coronavirus Task Force here in the Nashville area. A lot of things that we're looking over here this week as more businesses are opening up in other parts of the state, and only medical facilities here in the Nashville area over the next few days for some certain types of treatments. Now, a couple of things I wanted to point out. They are investigating a possible isolated outbreak at a homeless shelter at the fairgrounds. That's what they called it. 4 people testing positive for COVID-19. They say that they're now being isolated and that 220 individuals, both staff and homeless individuals,